This video is going to cover abnormal psychology, which is our next topic. So we are going to talk about the different types of psychological disorders. And of course, abnormal psychology is the study of people who suffer from psychological disorders. So first we have to define abnormality. So what is abnormality? Some of the common characteristics that we'll talk about are harmful or disturbing um, characteristics to the individual. So if it's harmful, if it's disturbing to others, not shared by many members of the population, and does not make sense to the average person. So if the characteristics follow those kinds of those four things, then it's abnormal behavior. Diving in, one popular term with um, abnormal behaviors or disorders is the word insanity. And insanity is a legal term, and the purpose of the term is to differentiate between people who can be held responsible for their crimes, who were then deemed as the sane, and people whose psychological disorders um, who could not be held responsible for their crime. Those were the people with psychological disorders or the insane. And one of the kind of big texts that helps us understand, and it's kind of the gold book, is the Diagnostic and Statistical Manual of Mental Disorders. It is referred to many times in psychology as the DSM-5. We're on the 5th edition of it at this point in time. It's referred to by the Roman numeral. So if you're looking at the letters, it's DSM-V, V for 5, the Diagnostic and Statistical Manual of Mental Disorders. And this is very important because it provides a way for psychologists to diagnose patients. It has the symptoms of all psychological disorders, and it describes what they are, things like this, and the statistics behind it. So, how many people are typically thought to have suffered from these disorders and things. And one important thing it doesn't contain is the cause of the disorder. So it doesn't say why someone might suffer from, something or another, because there are many different perspectives of why a person suffers from a disorder. We'll talk about that a little bit here. So it doesn't contain causes of these disorders, just a description of it and symptoms that a person might experience if they were suffering from one of the disorders. So first, we'll talk about anxiety disorders. We'll talk about several different ones. We'll talk about generalized anxiety disorder, panic disorder, and phobia. First of all, phobias are come about from contact with a feared object or situation that results in anxiety. So you've probably heard of specific types of phobias. A specific phobia is an intense fear of an unwanted situation. So for example, agoraphobia, those are people who are scared of open spaces. So agoraphobics stay in their homes. They're scared to leave their homes. Arachnophobia, the fear of spiders. There's also social phobia, fear of public embarrassment. So those are phobias. And a phobia is different than a fear. A phobia is an irrational desire to avoid an object or situation that a typical person would fear. So, for example, everyone is, one way or another afraid of heights. Not everyone, but most people, I should say, are afraid of heights. In that heights, when you're up high and looking down, that's dangerous. It's a dangerous situation. It is normal to feel fear in that situation, just as kind of a way to keep yourself safe. However, it becomes a phobia when that's an irrational desire to avoid any kind of situation where heights would be in play. Same thing with animals. A lot of people are afraid of animals, but having that specific phobia, that irrational desire to avoid something, some sort of animal, is where it differs between a fear and a phobia. And you can see on this chart the percentage of people surveyed. Around 20% of people have a fear of heights, while only about 5% of people have a phobia of heights. Next is generalized anxiety disorder. And a lot of these disorders you'll see abbreviated by their initials. And so that's the same thing with this one. Generalized anxiety disorder is a constant low level anxiety. Constant meaning, happening all the time for 6 months or more. At that point, it would be considered generalized anxiety disorder. Around 2/3 of the people who are diagnosed with generalized anxiety disorder are women. And the symptoms of this disorder are things like feeling jittery, feeling agitated, sleep deprived, constantly worrying, difficulty concentrating. And the one of the problems with generalized anxiety disorder is that it is generalized. It's not anything very specific. It's hard to identify the cause because it's just sort of a constant feel of dread and anxiety. It's been described as anxiety free floating. It's not about one thing specifically, so it's kind of hard to identify it and to relax it. Often it is accompanied by depression. These things can be comorbid, meaning that they occur together, anxiety and depression. And it can cause physical problems like high blood pressure. Then there's panic disorder. And panic disorder is acute episodes of intense anxiety without any apparent provocation. And a lot of times this is just called a panic attack. People will refer to these episodes as panic attacks. And they can have very real feels. People can experience heart palpitations, shortness of breath, a choking sensation, trembling, or dizziness. And it can be so severe that it can even be misperceived as a heart attack. Interestingly, smokers have a 2 times higher risk of panic disorder. And a real kind of hardship with this panic disorder is that a person can experience additional anxiety because they are so afraid of having one of these anxiety attacks. So it's sort of a self-fulfilling prophecy. It can be at times where people can get nervous and have anxiety about having anxiety. And then there is obsessive compulsive disorder, and often referred to as OCD. Obsessive compulsive disorder is persistent unwanted thoughts that cause you to feel the need to engage in a particular action. So this is sort of a two-part thing here. The obsessive goes with obsessive thoughts and compulsive behaviors. So it's repeated thoughts, often of, something bad happening or something like this, just something that happens again and again and again. It's obsessive and compulsive behaviors, so the need to act something out in order to reduce the anxiety. And the thing to kind of remember, because at times everyone experiences, unwanted thoughts. Many people will have these, feeling the need to straighten up or check to make sure the door is locked. And of course, that's, people will experience that. Oops. But the real question to ask is, does it interfere with everyday living and does it cause distress? That's the difference between someone who, is particular or is likes to be clean or likes to check to make sure that things are just so, and if it's an actual obsessive compulsive disorder. A lot of people will say, "Oh, I'm so OCD. I like things, to be really neat and clean and I like things just the way they are," but that's not really, true of actual obsessive compulsive disorder. It's not just that you like things to be clean, it's that there are obsessive thoughts that cannot be, stopped and these compulsive behaviors. It often occurs during late teens and early 20s and actually occurs to just about 2 or 3% of people. So, again, something that's sort of in popular culture, people refer to it a lot, but actual obsessive compulsive disorder is not as prevalent as one might think. And then there is post-traumatic stress disorder, often referred to as PTSD. And post-traumatic stress disorder, it includes flashbacks and nightmares following involvement or observation of extremely troubling events. Some factors that can lead to PTSD, not everyone who experiences a traumatic event will later experience PTSD, but some things can kind of make it a little bit more likely. There is if a person experiences great emotional distress during trauma, they have a higher risk for post-traumatic symptoms. Also, it's been suggested a sensitive limbic system increases vulnerability. So remember, the limbic system is what controls our hormones. So more stress hormones that are released and erupt into our consciousness, that gives it a more likely risk for developing PTSD. And there's also a genetic link. So very interestingly, a twin study was completed on men who were in combat. So when one of the twins was involved in combat and the other one was not, they found that the non-combat twin still had a high risk of cognitive difficulties like unfocused attention and things, even if they had never experienced combat. So there could be a genetic predisposition to PTSD or a risk factor for it. So if a person then would experience a traumatic event, they might be more likely to experience PTSD afterwards. Okay, so understanding the causes of these disorders. First of all, we'll look to the uh, different approaches. So the psychoanalytic approach, they would argue that any kind of unresolved unconscious conflicts between the id, ego, and superego would play out in this fashion. Make people more likely to experience these disorders. The behaviorist approach would suggest that conditioning, so we learn from bad events happening, or cognitive learning. So our interpretations and irrational beliefs cause these kind of different anxiety disorders. There's the cognitive approach, which suggests that dysfunction in ways of thinking kind of cause a better chance of having these anxiety disorders. So, a bump in the night, thinking that that's an intruder, just jumping to that right away might kind of leave us a little bit more open to having these things happen to us. And then the biological approach. So, natural selection, like I said before, with those fears or the phobias, we're biologically prepared to fear threats to keep us safe. So that could be kind of the basis for these things, that our fears just kind of get the best of us. And then there's the genetic link. Anxiety disorders can run in families, and of course, the brain. So, overarousal of brain areas that are involved in impulse control and habitual behaviors have been shown to be different in people with the different anxiety disorders that we talked about.